The following program is a co-production of Seattle Channel and Seattle CityClub and sponsored by Comcast.
With the stay-at-home order extended, what's the state's priority in dealing with the pandemic?
Governor Inslee is taking a very measured and thoughtful and data-driven approach, and I think he's keeping the safety of the Washingtonians foremost in his mind.
The U.S. Census, COVID-19, and China, all on the mind of this man.
When the word got out about the coronavirus in China, the WHO sounded the alarm, and many other countries around the world responded. The United States did not.
It's all coming up on Civic Cocktail.
Good evening, everyone. Welcome to Civic Cocktail. I'm Joni Balter. No in-house crowd tonight, but we have a great show from Seattle Channel Studios and via Town Hall Seattle live streaming. Up first, we welcome Dr. Raquel Bono, Vice Admiral for the Navy and Director of Washington's COVID-19 Health System Response. She joins us virtually. Greetings, Vice Admiral. Thank you so much for joining us.
My pleasure, Joni.
Thank you. I wanted to start kind of big picture here. The New York Times reported earlier this week that Trump administration officials privately believe that sort of the way things are going, that we could get to about 3,000 coronavirus deaths per day by June 1st. This comes at a time when many states, including our own, are easing some of our stay-home orders. Some other states are actually, fully opening. How does this make sense? Does this make sense?
Well, Joni, I think that what you're seeing here in Washington State is a very measured and data-driven approach to what the governor feels is appropriate in terms of easing some of those restrictions. And while we overall have had a good response, and I think it's very promising, what we would like to see is a more sustained response. And so in the state of Washington, Governor Inslee is taking a very measured and thoughtful and data-driven approach. And I think he's keeping the safety of the Washingtonians foremost in his mind.
But I'm wondering where, sort of the whole country's attitude, where does that, and from the administration, this sort of push to open up, where does that leave the governors? How will they exercise their authority?
Yeah, that's a great question, because I think, a lot of what the states are experiencing and the governors are probably right in the crosshairs of this is that, how do you balance the safety of your citizens in your community and make sure that you're giving them the maximum amount of protection from a very aggressive infectious disease? And at the same time, how do you take care of your community, your state's economy, and paying attention to those types of sectors that can open up safely? And I believe that what Governor Inslee is doing with his phased approach and his Safe Start program, he's taking exactly the type of measures that are needed to try and balance those two.
So these, balancing those two involves, sort of daily thinking through critical decisions. And we're in the middle of it too here in Washington State. Some outdoor activities opened yesterday. We've agreed to allow low-risk construction and even some certain elective surgeries to start. What makes those activities that I've mentioned and maybe some of the others safe at this time?
Right. So one of the things that we're looking at, or a couple of the criteria that we're looking at in all of these, is can we safely take care of, in the healthcare area, the patients and the healthcare workers? And can we make sure that we don't put them at additional risk of exposure to the coronavirus? And in the workspace, for some of the sectors, the businesses that are being able to proceed forward, is how well can they ensure that they're keeping the social distancing, that they have the right kind of facilities available so the employees or the patients or the healthcare workers can continue to wash their hands and practice, continue to practice cough etiquette and things of that nature. So in every step, we're looking at those types of criteria and whether or not these areas can meet them.
So, and I'd been talking to your staff and trying to, stay current with some of the things that you're having to work on. Personal protective equipment is a big problem right now. So you have some hospitals, they have enough, and some don't. So when we
Right.
say we can resume non-urgent medical procedures, does that mean just at certain facilities? And as long as coronavirus cases remain manageable at those facilities?
Right. Well, we're looking at that and we're giving every hospital an opportunity to look at their ability to make sure that they've got a sufficient amount of PPE available so that they can continue to protect the healthcare workers and taking care of the patients if they have COVID positive patients. Also, in terms of being able to make sure that the patients are able to come in and be kept safe from any kind of exposure. So part of that decision making in allowing some of those non-urgent surgeries is to make sure that it doesn't decrement the PPE supply or the PPE stores for that particular hospital, particularly as we're asking hospitals to maintain some type of surge capacity should there be an uptick in the infection rate.
Yeah, I want to get to that a little bit more, but
Sure.
I'd like to introduce you a little more thoroughly. You are a retired surgeon. You are Vice Admiral of the Navy. I guess that title stays with you for life, even though
Yeah.
you retired 6 months before coming here.
Yeah.
Your last job before retirement was consolidating the management of hospitals and clinics run by the armed services. And just the story I've read, and we haven't gotten to know each other that well, but you were at home in Virginia mid-March when this outbreak happened. What did you think at that time should be your role in combating the outbreak? Like, did you think, oh, I'm not gonna even be part of this, or?
Well, it was interesting, Joni, because, as I was watching this unfold internationally, and then as we started to see the cases start popping up on the East and West coasts, one of the things that did occur to me was that on one hand, I had spent a large part of my military career looking at these types of scenarios. What would we do in these situations if there was a pandemic? So on the one hand, I kind of knew what people were thinking as this was starting to happen. A part of me was somewhat relieved that I was no longer at the Defense Health Agency because I know
Responsible for the
right,
whole thing, right?
right, and what a big lift that was. But at the same time, I couldn't help but wonder, is there some way that I might be able to help out? And I didn't know what that was until I received a call from the governor.
So the governor found you somehow there.
Yes,
Yeah.
yes, yeah.
And so your first area of emphasis when you came here was the hospital system, the crunch.
Right.
People were so afraid at that time of this coming hospital crunch. But you're also working as part of that, if you think about it, long-term care facilities. There's a connection, obviously, there. How do we protect the elderly who are so vulnerable at this time, and we can't even visit them?
Yeah. Oh, it's really devastating to think that we would have to keep our most vulnerable people isolated in this way, at this time. But it's also the safest thing for them. We do know how this virus tends to act in congregate settings, in those settings where you have a number of people that live close together. We also know that some of our most elderly and some of our population that have other coexisting conditions are really at risk for a more devastating expression of this infection, of this disease. And so as we're looking at taking care of our residents and our clients in long-term care facilities, I think we need to continue to maintain a very high index of suspicion and take a very measured and a very an approach that keeps them at the safest level possible. And what that means then is making sure that they have sufficient PPE and that we're able to do the testing on them.
Well, the testing is the thing I wanted to ask you a little bit more about. You and I were speaking earlier today to kind of get ready for this, and you were saying that sort of, when this first happened, they really didn't have tests. They didn't know that it was present, but that now, if we have even a suspicion in a nursing home, there's a different approach, and it's because testing can go quicker. Could you explain that?
Yes, I think one of the things that we'd experienced early on when the COVID-19 was starting to manifest itself, we would know some of the symptoms and we would know to test for them to rule out whether or not they had the infection. But oftentimes our turnaround time was a little prolonged. And what we've been able to show is whenever your turnaround time gets longer than 48 hours, the problem is that if you haven't started isolating people who you suspect have the infection, then they are still able to infect others. And that's the other behavior that we know with this particular virus, is that it spreads very easily. It has a very high transmission rate. And so now being able to have testing where we have the results in a much quicker time, sometimes in 12 hours, sometimes as little as 24 hours, that's very helpful because then we can move to isolating people much more quickly.
Well, I want to ask you about that, the isolating. If somebody has, I don't know, mild symptoms, is the first thing to do, I guess, is test, but simultaneously, shouldn't you also isolate just in case?
That is the most prudent thing to do, Joni. If you have any suspicion, and that is part of the going forward, what our behavior needs to be as a community and socially, is that if you're not feeling well, then the best course of action is to go ahead and self-isolate and go ahead and provide, symptomatic relief to yourself. And, if possible, be tested for the coronavirus. But yes, the first step would be to self-isolate.
But in a nursing facility, they would have to do that for you, I guess, or at least suggest it. Yeah.
Yes.
Almost from the beginning, you teamed up with Microsoft a bit to work on a system that allows you to share information among the various hospitals across the state.
Yeah.
Tell us a little bit about this. This happened pretty early on, as I understand it.
It did, and it was very exciting. But it was more than teaming with Microsoft. What was especially helpful was being able to team with all the hospitals and the hospital executives, the Washington State Hospital Association, all the different coalitions, and the different associations. But it was being able to team with all of those folks and several agencies within the governor's cabinet. It was being able to team with them and then work with Microsoft to figure out what would be the best way that we could create some type of portal or dashboard where we could start looking at what the capacity is in the Washington State area and be able to look at it through different views, whether it's a state view, a regional view, or a county view. And Microsoft was very responsive to the input that we were getting from the different hospitals, and they were also very responsive and always available to help us actually build the tool.
So as I mentioned, we have the town hall audience joining us virtually and also submitting some questions.
Okay.
And so one of those, I'll read you off my phone. I'm not taking a call here. If comprehensive COVID-19 testing is critical to open our economy and we're short of test kits, now how and when will we be able to have adequate testing capacity? Boy, this has been a question throughout.
Oh, yeah. Yeah, you know what? We were asking ourselves the same question. And I think if I could, I think it's worth reminding people that when we talk about testing, there are actually probably three steps within the testing. There's actually taking the sample, and many of you have heard about that in terms of needing nasal swabs. And then the second part of being able to test somebody is having a reagent to do the assay. And what that does is it helps extract some of the nucleic acid from the virus. And then the final part of testing is having a machine that can actually read whether or not there are the coronavirus nucleic acids in that sample. And so in the state of Washington, we actually have the third element, the testing platform. We have really quite a number of those across the state. What we were lacking were the swabs. In a large number of cases, it was the swabs as well as the reagent for the assays. So we have not only has the governor been very, very energized about making sure we can procure as much as we can, but we've also started receiving some of these supplies, these testing supplies, from the federal government, from the CDC. And I
Are those
understand.
supplies here now? Because I know a lot of people are saying, "Boy, I'd like to get a test. I don't want to endanger a relative, or I want to know where I stand." And I know that in the city of Los Angeles, for example, if you want a test, I think that you can get a test if you call and make an appointment.
Right.
We're a little bit off from that. We're not there yet, right?
We're not quite there yet, but with the receipt of the first, the first pallet of swabs from the CDC, from the federal level arriving, then we should be able to open that up. We'll still need to probably target our populations for testing, and we spoke a little bit earlier about those clients and those residents in long-term care facilities. So we would want to prioritize certain groups of people, and certainly those populations that live in these congregate settings. And as you pointed out, Joni, our most vulnerable population, that's where we would want to target our efforts at testing right away.
So a new concern, 60 Minutes had a piece on this, and I've just been hearing this throughout our state as well, is that many hospitals could go broke. This is maybe more prevalent in rural areas, but it's also happening in some of the urban places. As we've been talking about, the hospitals have to spend a ton of money on protective equipment, staffing, and as we know, many people are avoiding going to the hospital for just a regular thing. They've been told to do that. They're avoiding that. So how are we going to keep the hospitals in business? Is that part of the effort right now?
Oh, it's very much a part of the picture. We have to maintain visibility of that because it is one of those things where we don't want to decrement the capability for healthcare delivery in Washington State as we're doing this, because as we move through this crisis, other people who have non-COVID conditions will continue to need their care, and we don't want to delay that any more than necessary. And so it's in our collective interest to make sure that we're doing everything we can to keep our hospital system as robust as possible, recognizing that there are some challenges to their ability to maintain that kind of viability. Fortunately, I'm sorry, go ahead.
No, I'm sorry, you go.
Oh,
please.
Fortunately, what we've been able to do here through some of the agencies in the cabinet, the Healthcare Authority and others, and the DSHS, is be able to identify ways that we can use some of the relief that CMS has offered. And so for those hospitals that have a mix, payer mix that includes the Centers for Medicare and Medicaid,
Thanks.
then we've been able to get some relief for them.
So this is something I think about a lot. How safe are we all outside exercising? I keep reading about droplets of COVID-19 somehow hanging in the air, or actually traveling backward several feet if emitted from a moving object, a moving person. What do you know about that? I think everyone is thinking these thoughts when they're out there walking, biking, running.
Sure.
And just wondering, is it really 6 feet or is it, like 10 feet?
The farther the better is what I would advise people. 6 feet, we feel 6 to 8 feet is probably good. What we're trying to avoid is that we know that when people are speaking, that they issue droplets, as they're speaking. And so we know that those droplets tend to fall within 2.5 feet of the person who's talking. Where the risk is when you're coughing or sneezing, and the droplets can travel even further. Now, when you're outdoors, the good thing about being outdoors is that usually there's a breeze or there's some element of a wind that helps, move those droplets out or disperse them.
I was wondering if the breeze was good news or bad news, though.
No, I think that's good. You want to move that out and disperse that. But at the same time, you also want to maintain your distance from each other, even when you're outside. So, the governor has been, very, he's encouraged people to be able to get outside a little bit, but maintain the social distancing and avoid crowds. And so, especially as the weather is turning, you want to be able to enjoy it, but you want to be able to enjoy the change in the weather safely.
Well, that begs a question that I have for you, and that is, as the weather warms, and we've seen this around the country, really. My son lives in Washington, D.C., and he's a runner, and he told me that he was out on the National Mall last weekend. It was really warm, and people were so bunched together. They were like 2 feet apart, nothing like 6 feet. How are we, as the weather warms, going to really keep people sort of on this message?
Yeah, that's really a challenge. It really is. And I think part of what can help us is having programs like yours where we get a chance to reiterate that and emphasize that even though things are improving, there's not a high level yet where we can say that this is completely contained. And so our best opportunity is to continue advocating for it, continue having these conversations, and allowing people to understand what the risks are. I think we're all kind of watching with bated breath to see if there is any kind of resurgence of this, and we're all going to be monitoring it and then adjusting our behavior based on what happens.
Yeah, so our state has, everyone gives us praise around the country, but I can tell there's sort of, I'm sure you've sensed it, a little bit of an attitude change even here. We've done a good job following the rules, but you can tell people are antsy. There's more cars on the road. There's more people going to work. How are we going to prevent our own cases from rising? And I'm even talking about this month.
Yeah. No, I completely understand. It is very tough to be, isolated and quarantined for so long. I mean, we are social people as a baseline. So it is very challenging. And I completely understand people's anxiety about remaining cooped up and the desire to get out there and socialize and be with friends and family. But it's one of those things where, you can't get the toothpaste back in the tube if you let, if we relax the restrictions so much that we then start having a resurgence. And based on what we saw last time with the high degree of transmission, part of our challenges is whether or not we would recognize soon enough that we would need to throttle back. So I understand the frustration and I understand the desire to get out there, especially with the weather, but I think it's also equally important to understand that we don't want to increase our own personal risk. But I think the other part of that is we would want to avoid increasing risk to others who may not be as capable of fighting this off.
Well, on that point, another audience question here asks, how can we as a community support our most vulnerable folks? What can each of us do?
Yeah, I think that's a great question, and I think it hits home to a lot of people. I think we all have loved ones or friends and family that we know that we have to make sure that we're taking care of them. And the best thing we can do is continue to support them while we isolate them from being exposed to others who may have the virus and pass it on to them. So for those of us that have family members, elderly family members that are at home with us, then being able to make sure that they get their groceries delivered and that their travel outside of the house is really kept to a minimum, making sure that they practice their own hand hygiene, and if they do go out, being able to wear masks, I think that would be very prudent, and then be able to continue to get the type of health care that they need if it's needed. So we all can participate in taking care and protecting our loved ones and our most vulnerable.
So I want to talk to you about the sort of criteria each of us will use as we make a decision to venture out. A lot of us have been pretty locked up at home and followed the rules, but aren't we all, sort of each time we decide we're going to go to the store, we're going to board an airplane, very few people have been doing that, getting on a bus, Sound Transit, aren't we all sort of weighing an amount of risk? In each and every step, or visiting an elderly relative, if you want to talk about that. How do we weigh that risk? I think it's so challenging to each of us to know how the heck do you come up with the way to know this risk over this need to get somewhere, go somewhere, do something.
Joni, it is so challenging because, like you and I spoke about earlier, even some of the simple things we do, like pressing a button on an elevator, we don't know. We don't know if
Just
the
did
person,
that. Just
right,
did that coming here.
right,
Yeah.
yeah. So I think so. Our best opportunity is to have a very high index of suspicion that there may be some type of transmission on any surface we touch. So you want to be able to clean your spaces on a regular basis. You want to be able to wash your hands as often as you can, particularly when you're picking up things or transferring things or touching other objects that you yourself have not cleaned. So you want to continue practicing that. You want to be able to make sure that you have that very high index of suspicion and, over wash your hands every time it comes in contact with something else. But it is kind of hard because there are a lot of behaviors and actions and activities that we do that we've done in the past where we didn't have to worry about that. So being able to actually retrace that in your mind and know when you've touched something that, it'd be appropriate to wash your hands as soon after you touch something.
So the governor's reopening plan, as we know, occurs in 4 phases. There's 3 weeks between the different phases. It gives time to recalibrate if you made a mistake. But with this much pressure, and the governor, you've been working with him, do you really would delay, say, a June 1st? I think that would be 2. If the numbers are wrong, you think he would be able to do that and would do that?
Well, I hope that's not what's needed, but I think the other reason that we're taking that 3-week in between the phases is that we know that usually if there is going to be an increase in the infection rate or a resurgence of that generally it takes about 14 days before you'll see that. So 3 weeks gives us, what we hope, a pretty good track record of whether or not we're seeing an uptick or things are remaining the same or hopefully continuing to trend downward. If there's any indication that it's not either staying the same or going downward, then I know that the governor is going to want to look at this in a tremendous amount of detail to see, should we stay the course or should we slow the reopening down a little bit? This has really got to be based on what we see with the transmission of the disease and how many people get sick.
I read somewhere a survey that 57% of Seattleites plan to avoid even medium-sized or large gatherings for a year or longer because of this. Yeah. Does that make sense? Does that seem like the wise course?
Well, until we have a better idea of who is infected and how it might be spreading, I think that's probably the only course that we have at this time. I mean, the other piece that we don't have but we are waiting for is the development of a vaccine. And so until we have something like that, or until we have some kind of medication that we know it's effective against the coronavirus, then we have to take every other precaution that we know to do. And part of that is being able to wash hands, which I just explained. But the other part of that is making sure that we don't inadvertently put ourselves at an increased risk for getting the virus by being in very large crowds where we don't know where the people in that crowd may have been exposed to the virus as well.
So I only have just a few seconds here, but could you tell me what's the biggest worry for the fall?
Yeah.
Just really briefly.
Yeah, well, as you know, in the fall, what happens is we typically have a seasonal flu, and that's where people are tend to get the flu in the fall. It generally starts in October, and it can go as far into April. And so one of the concerns that we have is with the typical flu season, is there a chance for a resurgence of the coronavirus? In other words, would we also see a resurgence of the coronavirus infections, and what type of peak would that recommend? Would it be the same level that we had before, or would it be stronger? Would it be less? But I think if you bring any of those two together, I think that really does increase the risk to all of the community members.
Well, thank you very much. We have been catching up on coronavirus in Washington State with Dr. Raquel Bono, who leads our health system response effort. Do not go away. We are coming back with one of our state's most prominent public servants, former Governor Gary Locke. And we are back at Seattle Channel Studios, missing our live audience. We are here with former Washington Governor Gary Locke, who was also U.S. Commerce Secretary and U.S. Ambassador to China under President Barack Obama. Hi, Governor.
Good to see you, Joni.
Thank you for being here. I can call you all the different titles that you have. I want you to put your Ambassador to China hat on for a moment, because I want to ask you about the fact that China, in the midst of coronavirus, has become sort of a political weapon almost, and seems like it will be one in the fall elections. What do you think of that?
Well, obviously, China has much to explain by way of the timing and the manner in which the coronavirus originated. When do they know it? What did they know, et cetera, et cetera. And just really, what is the real extent of the number of cases or the number of deaths in China? But I think that kind of is a deflection. And certainly the Trump administration and his campaign are using that to deflect away from the criticism of how they responded. Because when the word got out about the coronavirus in China, the WHO sounded the alarm, and many other countries around the world responded. The United States did not for a long, long time. And in fact, President Trump minimized it, said it's no big deal, not to worry, China's doing a great thing. And then on many occasions, every weekend for almost a month, he went and played golf. And yet other countries took the warnings seriously. They had the same information that our officials did. And in fact, some of the anti-China people within the Trump administration were warning the White House that this is very, very serious, and many of the health officials were doing the same thing. But other countries, other places, like for instance Taiwan, responded aggressively. They're only about 100 miles from mainland China, and they had many more people going back and forth between China and the Taiwan and the mainland, and yet through their protocols on social distancing and everything else, they were able to control the disease, and the number of deaths extrapolated for the U.S. population in the amount of deaths that they had in Taiwan would be the equivalent in the United States of less than 100. Oh, and yet, where are we today? Over 70 or 80,000 deaths,
for sure, yes.
and still rising, as you indicated in the previous segment.
Yes.
South Korea, that same thing. And many other countries.
So was they acting quickly? It was the getting on it? It was the not denying it? It was the not denying it?
They took it seriously. They did not minimize it, and they did not ignore the warnings the way that we ignored the warnings, the way the White House ignored the warnings. Everybody had the same information, but how is it that those countries were able to respond and keep the number of infections down and avoid the dramatic deaths? So I think that, yes, we need to find out what happened, get the truth out of China, but that does not excuse the inaction by this administration, this president, this White House, which has caused enormous toll to lives as well as our economy and millions of people who are out of work.
But we're not the only country that's blaming China. There are countries around the world now trying to say, that they didn't tell us about it quickly enough. They lowered the number of cases and deaths that they were having. I mean, what about that part? Doesn't China have some of that on them?
Oh yes, very, very definitely. And China needs to. We need a full accounting of what did China know, when did they know it, and what are the real numbers. But the point is that many other countries around the world received the same warnings from the WHO, saw the news coming out of China, and they responded. We did not.
So you recently, speaking of the campaigns here that are going to be going on this fall, you recently were in a Republican ad supposedly showing Joe Biden cozying up to the Chinese. And in this ad, one of the people that Biden was connecting to at 39 seconds in, I remember this, there's a picture of Joe Biden sort of bowing to, forgive me, I've known you a long time, I can probably get away with this sentence, a generic Chinese official who wasn't a Chinese official. It happened to be Washington's governor, Gary Locke. How the heck? What happened here?
I have no idea what they were thinking. I mean, the ad was trying to portray Vice President Biden as being too chummy and too friendly and solicitous to Chinese government officials. And in all the different vignettes, toasting with the Chinese president and the leaders of China, meeting with them, et cetera, they included a picture of me, as if
because they didn't know it was you, right?
As if I am another Chinese government official. And the Trump campaign says, well, no, they put that picture in to show that Vice President Biden was in China because of the presence of American and Chinese flags. Well, that doesn't make any sense, because when you have functions in Washington, D.C. or New York, whether it's at the State Department, the White House, the president's resort in Florida, and hosting the Chinese President Xi Jinping, they have the U.S. and the Chinese flag. The U.S.-China Business Council has a forum on trade issues with China. They have the U.S. and the Chinese flag. New York, there's a function there by the National Committee on U.S.-China Relations. They have both flags. So the presence of both flags does not mean it occurred in Beijing. So, it really gets down to the whole notion that for a long time, Asian Americans down deep are still viewed by many people as not really Americans. We're somehow still loyal to the land of our ancestors, whether it was the Japanese who were incarcerated during World War II, Japanese Americans who were born and raised in the United States, thrown into the concentration camps, Chinese Americans still viewed as being loyal to China. So unfortunately, it's a kind of a stereotyping, kind of a racism that still persists.
And did that drive your decision to issue? You issued a statement which was sort of on Gary Locke-ish, but I think a lot of people appreciated that you said something.
Well, it's something that's bothered me for quite some time, and I've been talking about how Asian Americans and many other ethnic groups are constantly being stigmatized, whether you're Muslim, whether you're Latinx, African American, Asian American. It's something that really we need to stop, because I'm just really upset and saddened by the growing division within our country. Economic division, income inequality, but also cultural division. And at a time in which we need the entire population coming together, united, to fight the virus, to reduce the number of infections, and to prevent deaths, we should not be dividing people. And we need a leader, and we need people in Washington, D.C. to exude calm, confidence, giving us reliable information, consistent information, being honest with us, and being very forceful. And when you're trying to divide people, that's not the strategy to attack this virus.
Moving along to one of your other hats, you are chairman of the Washington State Complete Count Committee for the U.S. Census. So how is the census collection going so far? It began right in the middle of all of this.
Well, unfortunately, the coronavirus has, I think, distracted people's attention from this once every 10-year civic national exercise that started under President George Washington in 1790. And it is the counting of all the people living, staying, residing in America. 2010 was a really tough year when I was administering the census. It was a very troubled census, predicted by all the national experts and the Congressional Budget Office and the watchdogs and the government inspector generals as the most troubled technology project facing President Obama when he took office. But we were able to turn it around, mobilize
I thought that was the healthcare hotline, no?
Well, that came later. That came afterwards. But at the time President Obama took office, he was warned that this was going to be a major problem. And yet we were able to produce the most accurate census in U.S. history. We reversed the decades-long decline of people not responding to surveys, whether it's, do you like the car that you bought, how was the repair of your appliance, et cetera, et cetera. And we were able to reverse that and eventually save the U.S. government $2 billion, and we came in 25% under budget. Unfortunately, because of the coronavirus right now, most of the states, including the state of Washington and all of our counties, are today behind where they were 10 years ago in April. I mean,
right, everything's delayed.
Everything's delayed.
Been in an induced coma, as somebody
right.
said.
And even though people have had more time to respond by email or by telephone or sending in the questionnaire, it's only 10 questions. It takes less than 10 minutes to fill out. Nonetheless, we are still farther behind now. Even though we've had a longer period in which to respond, we are farther behind today than we were 10 years ago.
Well, I thought Seattle is the best city in the country so far. What's that about?
Well, actually, Seattle is doing very, very well. King County is doing very well, and the state of Washington is doing very well compared to other states.
Yeah.
States like Minnesota, Nebraska, and Iowa, and things like that. We're among the top 4, 5, or 6 in the nation. But the fact remains, we are still farther behind in self-responding compared to where we were 10 years ago when the self-response period ended.
Oh, so I got to get the calendar from you because everything has been pushed back a bit. The way that you fill out the census, there's many ways to fill it out, mostly online, but phone and mail. And also, so you have field operators who are starting to go to people's doors. Can you at least tell folks what safety precautions for starters on that? Because a lot of people are like, no contact pizza and stuff like that. So what is the preparation for that?
Well, the knocking on doors operation for those who have not responded. I mean, if you haven't responded, the census will hire people and send them door to door.
They're out in
and they won't
now
start
in Washington. They're starting in some other state.
They won't start in Washington for about another month. In some places, especially in remote rural areas, people have not received a census postcard informing them of the need to do it online or to call it in by telephone because we don't have accurate addresses. And so people in parts of eastern Washington will start having people pay a visit to them to give them the form so that they can self-respond. But by and large, for all the other people in the state of Washington, if we have not, let's say in Seattle, King County, Central Puget Sound, or parts of Spokane or what have you, if people have not yet responded online or by telephone or by mailing back the form, the Census Bureau will hire people and start sending them door to door. And that's, of course, of concern.
Yeah, First of all, what kind of precautions are they going to take? Are they going to have gloves on, shields on, masks on?
I'm sure they will, but will you even be willing to answer the door?
Right? Maybe not. But I already filled mine out. Just want you to know.
And will they even be able to hire enough people who are willing to go door to door? So that is the challenge, which is why it's so important. And if you don't want people coming to your door, then please respond online, by telephone, or sending back the form in the paper form.
Well, one of the problems the census was going to have, but it was fixed, was, and some of the early press was about the fact that there was going to be this citizenship question on the census form. This is the first thing we heard about the 2020 census. We heard, that you're going to have to declare citizenship. Now, it went through some courts, and that question is not on there. But do people believe that?
Well, I think there's always been some suspicions and concern by various ethnic groups about confidentiality of the census, and will information in the census be turned over to immigration officials or law enforcement? Well, the 2020 census does not ask about citizenship because, in fact, the census is supposed to ask or determine how many people are living here, whether you're a citizen or non-citizen. It makes no difference whether you can vote or not vote, whether you're of even voting age. We're counting the people who are living in the United States, period. And so there is no question about citizenship. But nonetheless, there's a lot of suspicion that information in the census will somehow be revealed to law enforcement agencies. First of all, it is private. It cannot be revealed for something like 72 years. All right. It's a crime for any census employee, census taker, to somehow reveal information. Absolute crime. And if you don't want someone coming and looking over your shoulder to see how many people might be in the house and what ethnicity they might be, fill out the form. Do it online. Call it in. Fill out the paper form. That way nobody ever comes to your door, and they won't know. They have no way of knowing whether you're here legally or illegally.
So lost in some of that is the main reason why we do this every 10 years. What a lot of money relies on the numbers that are produced through this count. Can you just give us a version of what's at stake in the census, why it matters so much to be counted?
Well, it matters for two reasons: political representation, political empowerment, and also receipt of both federal and state dollars. The census is used to determine how many members of Congress the state of Washington will have. And the number of seats in Congress is fixed. So as the population grows, the number of people in each district must increase. And states that are growing faster than the national average will actually gain a seat in Congress, like we did in the state of Washington based on the 2010 census.
Mm-hmm. The 10th congressional district.
And at the expense of other states like New York, which lost seats.
Yes.
Because other parts of the country were going faster and they were entitled to more seats. The legislature uses the information to draw the boundaries of our legislative districts, and with the fast-growing population in central Puget Sound, it's quite possible that a new district might be squeezed in to parts of central Puget Sound, but requiring that other parts of the state have their districts expanded.
Right.
I mean, there'll still be the same number of legislators in the Senate and in the House of Representatives, but the boundaries may change to reflect that population, to make sure that every little district has the same population. But it also determines the receipt of money.
A couple bucks on the table there, right?
Well, tens of billions of dollars in federal funds flow out to communities based on the number of people in those communities. And for basically in the state of Washington, in terms of, or for people across America, hard cash, it's about $2,300 per person going out to communities based on the number of people in that community. And it's money for housing, for police, public safety, transportation, highway money, transit, also, for instance, public health. And as we know now,
there's a topic.
We could use a lot more money in terms of public health dollars. And if we are undercounted, that money, that $2,300 in today's dollars, will go to some other state. And actually, it's even more than that, because a lot of allocations are based on, for instance, population density or the number of seniors. So, for instance, using the census to know where seniors are and how densely they're grouped together in a community can actually affect the reimbursement rates under Medicare for the pharmacists. So there are billions and billions of more dollars that are influenced by the census, in addition to just the federal dollars that go to communities based on where people live, for housing, for child nutrition programs, for senior programs, transportation, public safety, public health, you name it.
And so on the congressional decisions that are made there, Washington is not, as you said, going to get a new seat this time. We're not projected to, but Oregon is going to. And who's losing those? Do you know who those states are yet?
Well, the states that are at risk of losing include, obviously, the East Coast states, the New England states like New York again, maybe Pennsylvania, possibly even California, while they've been growing.
Well, there is some out-migration.
Yeah, while California is still growing, it's not growing as fast as the rest of the country, and certainly not parts of the Northwest like Oregon. So our population is growing pretty dramatically here in the state of Washington, but not outpacing the rest of the country such that we would gain a new seat in Congress.
So the way that we use the information, and that's sort of the time crunch that we're under, we need to collect the information. We could keep delaying it because of coronavirus, but we have to get this information to our redistricting commission in time for the 2022 election.
That's right.
And so what is the absolute last possible delay that we could get away with and still provide the information for that commission? Because they have a whole long rollout to do their work.
Well, normally, if this had been a normal time, the census would have been delivered to the White House in December of 2020, and then that information released to the states, and then the states, starting in January or spring of 2021, would start drawing the boundaries for their congressional districts and their state legislative districts, and they would have basically all of 2021 to finalize those maps and those boundaries. And then people would know in January of 2022 whether or not, what the boundaries are, and they could decide whether they're going to run for Congress or oh my gosh, there are now two of us members of Congress living in the same area, and one's got to move, and otherwise one of us might lose a seat or something.
Don't they often draw those to include the representative that's always there? They did that last time.
Well, they kind of do that. They kind of do that. We have a nonpartisan redistricting commission.
We get a lot of credit from around the country for that because of the chairperson is non-voting and nonpartisan. And that helps us.
Yeah, we have a nonpartisan group and equal Democrats and Republicans, and then they choose another person, a neutral person. And our maps are fairly consistent. It's not like one long sliver that goes from Canada all the way down to Oregon. We put groups, communities of interest together so that they have common interests, common issues.
But if you had to guess, the next drawing of those congressional districts is very likely to sort of pull some back over to the west, some of the boundaries back over to the west side, because that's where the population growth is.
Well, because the population growth was so big, and on the west side, one of our districts on the west side actually had to go into eastern Washington.
Right.
To pick up enough people. So this is very, very important. But the question was, will the delay in the census taking affect that redistricting? It will probably give less time in 2021 for that redistricting commission to do its work. But let's hope that they will be able to finish by December or the fall of 2021 so that people can gear up for the 2022 elections.
So what is the way that you reach the hard-to-reach communities? You mentioned that you go out, you do, if census forms haven't been returned, that you do send out the field operators. But is that, I don't know if that's the best way to reach hard-to-reach communities. There are other ways that you get out and say, you got to fill out your census form.
Well, that's where community groups and civic leaders are so important. I mean, all the messages from federal government officials are not persuasive, because if people have a distrust of government, they're not going to listen to a U.S. senator or even a member of Congress or someone from the Census Bureau or the White House. So it's important that we have leaders that they trust, which might be religious, faith-based leaders. It might be the heads of the nonprofit organizations.
But are these gatherings? I mean, things that may or may not happen this year?
Well, what has often happened?
Where do they contact them?
Often they send out flyers. They speak from the pulpit, but now church services have been, are not allowed. And so it's really going to be, people are using electronic, emails and things like that. But also, they used to have like community fairs. If there was a parade, if there was a festival, a day in the park, these community organizations would put up booths.
Yeah, but how do they do that now if we're not going to have summer festivals or we're going to have limited ones?
It's all by their communication mechanisms, whether it's newsletters, telephone trees, emails, any and every way in which they're trying to communicate. And so a lot of these organizations receive grants from the state, from nonprofit organizations and foundations to try to get the word out. Again, trusted leaders of the community.
Is the way to do that.
And they're having to be very creative now in getting their message out.
So I used to cover demographics a while ago, and there was always a short form census form and a long form. But you said when we were talking about this show that it's going to be all short form this year.
We haven't had a so-called long form in several decades. I think not until,
So what do you miss?
Well, the long
Number of bathrooms, type of heating
yes,
system?
The long
Those
form,
are some questions, you know?
It used to be that the census was always a long form and many, many questions. 100, or maybe dozens and dozens of questions, and then they went to a time in which there was a time in which most people got the short 10-question census form, and maybe a fourth or a tenth of the population got 100 questions. We've gotten away from that, and so the 100 questions are now asked each year to a select sample of people across America. But what used to be on that long form when, as part of the census? Well, how do you go to work? Do you drive? Do you take the bus? How long does it take to get there? How many bathrooms do you have in your home?
remember, yeah.
Do you have hot water? What kind of heat do you have? Is it coal? Is it oil? Is it gas?
That's not the
Is it
most
electricity?
irrelevant question.
I know.
If you think about what we're trying to do on climate, that isn't.
What is income? What is your income level? What is your level of education? Where did you go to school? They asked everything to really try to get a profile of the American population. Well, that detracted from people's participation.
It was probably just too involved, too detailed.
It was too much.
So I'm gonna close this out.
But we don't do that anymore. We don't do that. This census
that's
is
a
only
good
about
thing.
10 questions. It's so easy to
Still
fill
in the
out.
short form here. You are. I want to go big picture here to close this out. How does coronavirus shake out from a global superpower perspective? After all this happens, there's a real concern in this country that China may be ahead of the United States as a superpower. What is your thought about that? Or you think people are too mad at them for what's happened?
Well, certainly they're a major political force, a major military force in the world. Actually, a lot of cooperation with the United States on a whole host of issues, including military exercises, joining together to stop the piracy off the coast of Africa. China contributes a lot to UN peacekeeping forces. But there is a huge rivalry, a huge tension in our relationships, military, but also in terms of trade and economics, and now we're seeing in terms of public health. The American economy is so strong that we will still be number one in terms of output per person for many, many decades. But China is rising dramatically, and we need to make sure that to stay ahead, we've got to really invest in our education system. We need to put more money into R&D, and we need to help our industries remain competitive. We cannot rest on our laurels because China is moving very aggressively ahead.
Thank you so much. We have been catching up with former Governor Gary Locke on a variety of topics, including the need to participate in the 2020 census. Thank you so much, Governor, for spending your evening with us. Civic Cocktail returns in June. Thank you all for joining us, and good night.